Now, are there any treatment, you know, if someone doesn't want to have surgery?
Yeah, there are varying treatments that have been used, not curative. When I say curative, meaning it hasn't cured you of your fibroids. For example, you could use drugs that would suppress the hormone that causes it to grow. But remember now, if you do that, that is your female hormone. So if we give you drugs that is going to suppress that hormone, then you're actually going through what we call menopause, because you're not getting the estrogen effect. And therefore you'll get other complications. It may affect your bone and thinning out of your bone. So you know you will have a problem with that. There is also laser, where they can try to kill the fibroids with beams from outside. But when they kill that fibroid, it is left as dead tissue within you. So that may also cause problem.
Now,
so I usually go for, if we're not, is either we're going to have surgery or we're not going to have surgery. And if they're not big, if they're not a bother to you, don't worry. It's not cancer, so you will not die from the fibroid. So that's what I usually encourage my patients.
Mm-hmm. It may seem that more and more females are developing fibroids in
I wouldn't say that more and more females, because maybe what's happening is that people are more coming to going for checkup.
Okay.
Because sometimes in the past people never used to go to doctors often. So now with all the internet and all the way people knowledge has increased, people are going more regularly to their healthcare provider. And I hope they're going more regularly to do their pap smears. So as a result, we may pick up fibroids. You know, in the past, they might not have picked it up at all. Because as I say, it can be there silent within you and you don't even know it's there. And it's an incidental finding. So I wouldn't say, because the books have not changed in terms of the incidence of fibroid. It still remains around 20 to 25% of women. And I mean, these are books we're talking about that have been, you know, published years ago. So I don't think the incidence has changed. But people may be becoming more knowledgeable about it, scared about cancer, and therefore we're doing more surgery than we used to do in the past. So, and we're doing surgery for situations where it's not really necessary, but the client pressures you and said, yes, I want it out. It shouldn't be there. I don't want it there. Take it out. And then we'll go ahead and do either history, because we're doing hysterectomy now for quite young patients. You know, 35, 36-year-old are now requesting, once they have completed their family, they are now requesting that they will take out the womb. Because once we take out the fibroids, there's no guarantee it won't grow back. That's the other thing. If we do what we call a myomectomy and just take out the fibroids, within 6 months to a year, you may get fibroids again. Because we have not touched the reason why you have it in the first place. The reason why you have it in the first place is your genetics, your makeup. And you tend to find that, you know, your mother had it, your sister had it, your auntie had it, you have it as well. And if we take out the fibroids, we have just dealt with the fibroid you have. It prevents the excessive growth of that what I've taken out. But if they come back, they can cause you trouble again. So most patients, once you counsel them that it may mean another surgery down the road, they will say to you, know what happened? I'm finished with using my uterus, just take it out for me and I'm happy with that.
Now with this increase of knowledge and more people, I guess, talking about it, you hear talks about maybe it's the diet that will contribute to something like that, and you start hearing people saying, well, don't eat that.
Don't eat red meat, you know, don't eat certain things. The studies have not really proven that that is so. It is common in black people, yes, but the studies have shown that it's not so common in African blacks. So it may be related to our diet, but there hasn't been any concrete evidence to say it's what we eat, why, or we're getting large fibroids. It's happening in Jamaica, same thing in the rest of the Caribbean, all the Caribbean region. You know, it seemed to be quite a problem. So because 60% of our elective cases are as a result of fibroids. But I think the important thing is to let patients know, women know, that it's not something that would kill you. It's really that it shouldn't be that the fibroid gave you cancer in terms of getting a sarcoma. So, you know, unless it's giving you a problem, if the ultrasound just says small fibroid, sometimes the ultrasonographists can't even measure the fibroid. She just gives an impression that there's a fibroid. You don't need to be concerned, you don't need to be worried.
Well, Dr. Slater, let me thank you very much for being on Inside Story and enlightening us about this issue of fibroids.
Thank you very much for having me.